You know, when a patient comes into my office who has a tooth that's missing, one of the frequently asked questions is, can this tooth be replaced or this space be filled in with an implant? And yes, it can, but maybe what the patient should be asking is, what are my options? Is an implant, or do I have other options to replace that missing tooth? And you do have other options. And another good consideration is a dental bridge. Now, an implant may be considered one of the best single tooth replacements, but don't rule out the possibility of considering a bridge. And there's reasons why you should consider a bridge. Basically, what a bridge is like if you use the analogy of a bridge you're driving across, and you have the bridge and you have land on either side. Well, that's basically what a dental bridge is. You have the tooth that's missing is a bridge, and you have the teeth on either side as a support. We call those the abutments. Now, if those teeth on either side of the space are weakened, an advantage of considering a bridge is that, number one, you're going to put a crown on both those teeth. They need to be crowned anyway, and then you're going to add that single tooth as a bridge, so you get what we call a three-tooth bridge. And so you're really getting the triple whammy effect, where if you do just an implant, you're only taking care of the actual tooth that's missing, and you're not regarding the two teeth adjacent to it, the health and integrity of those teeth on either side of the space. One other thing is a matter of timing. If people are very, very busy with their schedules, sometimes for an implant it'll take anywhere from 2 to 3 visits, and sometimes anywhere from 3 to 6 months. The first visit usually placing the implants. That's a surgical procedure. Second visit usually 3 to 6 months later, uncovering it, and then the third procedure, which involves then going to your dentist. He's the one then who fabricates, your general dentist. He's the one who fabricates the crowns. That would take another 2 to 3 to 4 appointments in addition. So an implant could take anywhere from 3 to 6 months, where if you do a bridge is usually a two-step procedure. The first appointment, you go ahead and you have the tooth come in, the patient comes in, and you shape the teeth down and get it ready for the bridge, and you take the impression, you send it to the lab, and anywhere from 1 to 3 weeks later, you have the patient come back, and we insert the bridge. So you're basically getting all that service done in a short period of time. And maybe one other aspect to consider the bridge is the aspect of economics. From a cost standpoint, a single implant tooth could cost anywhere from 3 to 4 times the cost of a single tooth, where a bridge is going to cost the price of 3 crowns. And so if you're doing an implant for the cost of 4 crowns and a bridge that costs of 3 crowns, you're getting 3 times the teeth done for the price of 1, and it's costing you quite a difference in cost when it comes to implant versus a bridge. Those are just some things to consider when you do bridges. Other aspect with bridges is the cosmetic side of bridges. We can do beautiful bridges right now with all beautiful cosmetic porcelain. Also with our laser, when the false tooth emerges out of the tissue, we can create what we call a nice tissue emergence out of the tissue and just give you a very natural looking appearing, as if that false tooth is just emerging out of the tooth, of the gum area, like nature meant it to be. So that's some of the things to think about when you think of bridges. If you like this information, and if you're interested and would like to learn more about our services and what we have to offer, and even more about our office, you should really visit us on www.drheringer.com.